Dr. Sayer, can you introduce yourself to our audience?
Yeah, sure. So my name is Ed Sayer. I'm a psychologist and a Buddhist practitioner, and I've actually been doing this a very long time, in excess of 40 years. And I'm a father, a financial planner, which is kind of an interesting sideline that I do, and I'm basically just somebody who enjoys life. So that's pretty much me.
Very
Yeah.
excited to have you here. Ed used to be my boss at the Community Health Center of Franklin County, where he was the CEO. I was actually hired by Ed to serve as a psychologist and later the behavior health director. I have a lot of fond memory working at the Community Health Center, especially interacting with Ed and creating a mental health program together. All right, so let's right into the questions. The first one is, Ed, I know that you have a booming private practice these days. Can you tell our audience a little bit about what you enjoy most these days working with your
Mhm.
patients?
Yeah, sure. Well, the practice is called Cape Light Psychotherapy, and it's 98% online. I do it with my wife, who is a psychiatric nurse practitioner, and she does some couples counseling in person. So that's sort of the 2% that we do. But we both, I think, what kind of makes it unique is that it's very heavily influenced by a spiritual practice that we each have. In my case, it's Buddhism. She has a different spiritual practice, but many of the values are the same. And so, even though we incorporate traditional, psychiatric and psychological processes such as, cognitive behavioral therapy and, insight-oriented therapy and so on, there really is this quality of cultivating gratitude and, trying to really have a kind, loving heart. I think that comes through with both really our practice.
What a wonderful combination of traditional psychotherapy, like Western psychotherapy approach, and some of these Eastern spiritual practice.
Yeah, I think it's somewhat unusual for practices to have to emphasize the spiritual aspect of our engagement with the world, and I think that's really important, and it's often overlooked. And I have found, when I started as a psychologist, 40 years ago, it was very traditional. I mean, it was all psychodynamic, Freudian kind of stuff. And then over the years, it became more sort of ego based, CBI, those kinds of things. But in the last 10 years, 10 or 15 years, it's really been influenced in my case, by my Buddhist practice. And so there's a lot of sort of Buddhism that is in my engagement with the people that I see in counseling.
I think I actually see that trend even when I was a psychology intern working in New York. Supervisors were incorporate some spiritual practice, especially Buddhism. In the university counseling center where I worked, parents were seeking out for it, students were seeking out for it. So what do you think that's about? Why is it that all of a sudden there's this renewed interest in?
I think that there's a lot of alienation in our society. I think people, there's been a degradation in the impact of family, structured, religious organizations, um, even friendships. I think sometimes have been supplanted by, uh, AI. You can make an AI
Ah,
girlfriend, and you can have a relationship and so on. So I think having a real person who can actually give you the experience of being seen and sort of reflecting on our place in the world is profoundly important. And it's one of the ways that I get clients really is that I think they're attracted to. Many of them will say, "Oh, I like that you're Buddhist, and I like that you're emphasizing that." And people will find something that they kind of resonate with, and select you as a counselor. I think in one of your earlier videos about finding the right, you were encouraging people to find the right match. And that's so critically important. I loved that you said that because, you can be, world's best psychiatrist, psychologist, but if you don't have a match with your client and you're not talking the same language, that syntax isn't the same, or the cultural fit is poor. Um, then it's really not gonna you're gonna really struggle with it because psychotherapy is actually hard. I mean, there's a lot of work involved in it for the patient and also for the therapist. So the fit, I think, is very important.
Uh-huh. I heard you mention AI and technology, alienation. I definitely seem like a revolution of AI technology is coming into psychotherapy, the therapeutic space where you and I work from. For example, these days it is very common for some patients, especially the Gen Zs, they will bring all of their questions to their AI chat. They will bring them to AI first, consult AI, and sometimes bring in the script from their conversation with the AI and just check in with me to see, hey, what do you,
Okay.
Dr. Cheng, what do you think about this? So our session is really just sometimes like confirm or disconfirm or like a conversation, a debrief after their conversation with AI. Have you seen any of that in your practice? What do you think
All
about it?
all the time, all the time. I'm so happy to hear you say that because I wasn't sure whether it was, unique to the patients that I had. I mean, I saw this one person who he would come back the next session and say, I replayed our session with Chat GPT. GPT said this and you said that. So how do is that? And what was funny was that I often thought like, well, that's, Chat GPT, that's actually a good suggestion. I should have thought of that myself. you know, I think there
Yeah.
really is a role for an AI assist for live psychologists. I mean, I think it's a real role, but I see it all the time. Many of my patients use AI as a supplement to the work that we do together.
Uh-huh.
Yeah,
So
yeah,
I heard you say you're excited, you're happy to hear that. So it doesn't seem like you're threatened by AI. Although I felt a little,
did you?
concerned. Let's just say, like, what do you think AI will replace us in the future the same way it is replacing a lot of these knowledge workers? You think we will basically go extinct one day as a profession?
I think it's going to have an impact. I think it's going to cut into the base of people who are seeking live psychologists of the quality that you and I are, superior quality psychologists. Um, but I think, yeah, I mean, it's cheap. It's much less expensive. It's available 24/7. And I think when it's based on a large language model and it's specifically attuned to psychological issues, you know, it, it can be actually pretty effective. I'm not threatened by it really, but I think it has a role to play, and I think that many people will make use of it. I mean, do you disagree? I mean, do you think you think that it's not going to play much of a role?
I definitely agree with you. I think it will play a more and more important role. Right now, there's a lot of regulations protecting the profession of psychotherapy, but I would not be surprised that, some of them might be impacted.
Yeah, I mean, one of the things I always loved about working with you, and that you actually taught me, I think, to appreciate more than I had previously, was the impact of culture um, and how that influences, how we see the world and so on. And I know it's, one of the reasons why I think you moved to Hawaii. You had just a different culture. Um, and so I don't know. I mean, I'm not sure that AI can really replicate that somehow. Sort of the cultural aspect of of the relationship. And then also at this point, I mean, in actual in face to face or online counseling, it's so important to read the nonverbal behavior of the client. And I don't. I mean, I assume that the AI is nowhere near doing that now. I mean, maybe in the future they'll have optical systems that can kind of interpret that kind of information. But right now, I don't think that's doable. In my online practice, although I am sort of certified to treat children, I don't do any children online because I really feel it's important to be in the room with them to sort of just observe what they're really doing and how they're acting and so on. I don't think that can be done online very effectively.
Yeah. Switching our topic a little bit, why do you think people should get into therapy? And what do you see as some of the biggest barriers for people to, seek out therapists?
I don't think there's a simple answer to that. One of the important elements of it, one of the first things that come to mind is that, many of us feel that the quality of our life is dependent on the object of our attention. So, and what I mean by that is, the object of our attention might be our job or our partner or, you know, our health and that kind of thing. If we're focusing on those things and they're not what we would like them to be, we feel depressed or we feel like there's something missing. The object of our attention in that sense. But I think in reality, 100% of the quality of our life is not about the object of our attention, but it's about the quality of our attention. So, and what I mean by that is that whatever is happening out there, the object, it's really how we engage with it and what kinds of attitudes and intentions that we're bringing, or that are capacities of the heart to be kind, to be joyous, to be to cultivate some equanimity. And those are things that you can bring to whether you have a good job or a bad job, a good partner, a bad partner, a health issue or not. I mean, life is going to have challenges. We know there are going to be unpleasant things and pleasant things. They're just the way that it is, right? And you can't if your happiness is dependent on whether you have a good or a bad situation out there, you're going to be happy sometimes and not miserable other times, I guess, because it didn't go the way you wanted to. So that's not. I think happiness is not the goal. The goal is to sort of cultivate this equanimous quality of mind where you can engage with everything with, a balance. You're not overly intoxicated by praise or happy situations, nor are you, damaged by events that happen that are unwanted. So back to your question about why I think therapy is important is that this is not a common way of thinking for 99% of the people in the world. I mean, we're sort of a different. So I think what therapy can do is it can help, restructure how we engage with the world. And you really need a guide for that. I think you need a guide for that because it's very difficult to get out of our own way when over the course of a lifetime, we've developed a certain way of looking at things. I don't know if that answers your question, but I think that's really, kind of, that's one of the big reasons why people should get into therapy. And why it's challenging is that people, everyone who comes into therapy doesn't feel happy. They know something's wrong with their life and they want something to change, but what they want to change is their partner. If only my partner stopped doing that, or she stopped drinking, or stopped beating me up, or, my boss was nicer to me. The only thing they don't really sort of grasp that they need to change is themselves and the way that they approach those kinds of problems. It's very hard for people to change their own behavior. They think other things should change. So that's a big barrier. And I start many of my sessions by stating that almost. It's like, I know you're here because you're not feeling good, but I just want to let you know it's going to be hard work and it's all about you changing. So,
yeah,
you know,
yeah.
you know,
And I assume some people will have a hard time hearing that, right? Like because
they
now they
do.
realize the change is internal.
Some of them look at me with wide open eyes, like, what? I mean, that's really, that doesn't sound good, Um, but yeah, people get it. People get it eventually. They get it
Yeah.
eventually. Yeah.
Yeah, that really is a very interesting approach to therapy. So I'm assuming that this internal change you're describing doesn't preclude changing the reality, right? Like one can still change it, probably even better at changing the reality if they can reframe the issue and find the peace that you were talking about.
Absolutely. I 100% agree with that. I mean, it's going to be easier to feel equanimous if you have a partner who's loving and who sees you and is respectful than if you have one who isn't. Um, it doesn't mean that you can't still have a calmness with a partner who doesn't do that, or if you have a job that isn't ideal. But it does take more work, and it takes a lot of therapy is about training our minds, and that's I think a lot of where my Buddhist influence comes in because Buddhists do a lot of meditating, and a lot of people have a misconception about meditation, which I incorporate into almost all my therapy. But people think about meditation as a calming technique, which it can be. But in Buddhism, meditation is more about noticing what is present, both the pleasant and the unpleasant, not necessarily calming, but you're just noticing without judgment. And that's a different than sort of the conventional view of what meditation is about. But noticing without judgment and seeing things for how they really are, rather than for the accumulated way that we have, mapped things in our minds, is really, I think, very important.
This leads to my next question. What do you think therapists are doing in the session? What is really the magic of psychotherapy?
Well, I love that question. I suspected you might ask me something along those lines, and I have been pondering what the magic is. I love that word of it. I think the magic is really joining with the person and getting them to re-examine the belief system that they have. Everybody sort of has a belief system that is in our, mind, that uh, sets us up for engaging with the world or the person that we meet on the street. And I think that we we form judgments almost immediately when we see somebody, or we size up something, or it's making it, is this good, is this bad, am I doing it right, am I? And I think that what happens in good therapy is that you learn how to control your mind so that you're not judging so much. You're just acknowledging what is present and seeing it clearly without your preconceptions. We look at a what we call a chair, and when what is it really? I mean, chair is not something that actually has a reality, other than it's dependent on having some slats of something to sit on. I mean, it's comprised of component elements, but it could be anything. What we call a chair could be a stool. It could be something to put flower pots on. It could be something for a child to play with. But we see that object and we think, oh, I'm going to go sit on that. Okay, that's fair. But it has, that's something that we've created for it. What it actually is this collection of, materials that it could be anything really. You don't even have to call it a chair. You can call it a bubble. And so you don't we just bring our learning history to everything, and I think that gets in the way of seeing the world clearly.
Oh, that is very interesting. Yeah. So, like what we normally call a chair is really is a mental construct, right?
Yeah.
Yeah.
And so people, I think, in therapy, they begin to see themselves, a lot of, unfortunately, we apply these mental constructs, as you so aptly refer to them, to ourselves. We are, I'm a depressed person. I'm a quiet person. I'm a this kind of a person. I'm a loving person. I'm not, I'm an angry person. I'm a damaged. We have these labels that we put on our behavior. And I think that, good therapist has us re-examine that and get out of our own way. Um, because Buddhists like to say there really is no self. There's no, self is just a process of energy that is coming together in this particular moment in time. This thing that you're talking to right now, this Ed Sayer thing, is just it's just a bunch of energy, but it's really nothing real. There's nothing substantive here, actually. And there's something to that.
Are there any additional thoughts about what exactly are therapists doing?
I'm pretty active. I mean, a lot of therapy, and I think that's really more the trend in psychotherapy these days, is to have kind of an active therapist rather than, the traditional, you know, scratching the chin, kind of thing.
Uh-huh.
But yeah, I mean, I'm curious. I think that I'm curious about people when I meet with them. What kind of makes them tick? I mean, what do they think about? What do they do with their spare time? So there's a lot of inquiry about how things are going for that person. Tell me in more detail about what it's like to be you. Even when you sit down to eat. I mean, what are you thinking about? So one of the nice things about meditation is that you can make mental notations about what comes up. I mean, you're sitting there quietly, and you're thinking about dinner. You're thinking about you know, your partner, you're thinking about, this when I'm going to go on vacation. What kinds of thoughts come up? And that's revealing for people, because a lot of times people don't even know what they want. They don't even know they know what they have they're not happy with, but they don't know what they'd like to replace it with. And I think meditating can help you, see what bubbles up, and what your true nature might be like.
Interesting, interesting. How do you incorporate the meditation aspect into therapy?
Well, I don't do it in the sessions because I feel like, there should be more interaction between the therapist and the patient. I mean, I've done it occasionally in the session for people who can't, who don't know how to do it or they say they don't. So, but usually it's an instruction for them to do it, in between sessions. One of the barriers for successful therapy, I know you asked me this earlier, was that a lot of patients unfortunately come to therapy and they think, oh, I'm having my weekly 1 hour with Dr. Cheng. And then that is great. And you tear up and you have an emotional experience with Dr. Cheng. And then you leave the office and you go and do what you've done, you know, every day since then. I mean, you have to be able to carry it through to the next session. I mean, there's a lot of work that has to happen between sessions because that 1 hour a week is not going to be enough to change anything. It has to be constant. You need to you need to pay wise attention every moment and be mindful of what you're doing and what your intention is. And, the catalyst that Dr. Cheng is giving you for that 1 hour, that's great. But that is something that needs to be carried through into your daily life until you see her again. If you're not doing that, you're going to be in therapy for decades. It's not going to change anything. And in a way, a therapist in that situation is kind of an enabler because you're both pretending that things are going to change. They're not going to change unless you do something. The patient, I mean,
Yeah, definitely, definitely. I love the idea of therapy itself as a catalyst, right? But really, there's a lot of work outside of therapy. Anything else you think our audience might be interested in knowing about you, about your practice, about therapy in general?
well, people often ask me when they call me up and have an initial interview. So I hear, Dr. Sayer, that you are a Buddhist. That's intriguing to me. But what does that actually mean in the therapy? What does that mean that you're a therapist? Or, that you're Buddhist, and how will that show up in the counseling?
Wow, that's a great question. Yeah.
Yeah, it's a good question. I think there are really a few things in Buddhism that are core concepts, and one is the idea that suffering is everywhere, and suffering. What causes suffering? Um, what causes suffering is clinging and craving. So we attach onto things, and then once we attach onto them, we want to keep them, and if we don't have them, we start feeling like there's a loss. So the clinging is incredibly important. And the way around that, there is a way around it, and the way around it, it's not so simple as not clinging, but it's really cultivating aspects of the mind. So you want to have, you want to cultivate what's called right view, which is the idea that everybody has a perspective that's valid within their own uh, frame of reference. And so we shouldn't feel like, we're always right. Somebody else can have a point of view and they're not necessarily wrong. It may not be something that is, consonant with what we are thinking, but our view is that everything is, everybody can have a perspective. And I think the other key thing is having a wise intention. So what are we really trying to accomplish? Are we approaching and meeting everybody with basic friendliness, um, joy in the success of others, compassion, and equanimity? Those four qualities are called the Brahma Viharas in Buddhism, and they represent, sort of these qualities of loving heart, and so a lot of that comes up in the therapy. That I mean, approaching situations, and there's guidance around, developing these four qualities and bringing them to all interactions. The other thing that I think is important from a Buddhist perspective is that everything is impermanent. Everything passes eventually. Everything changes. Similarly, if you're happy, it's also going to pass. So, there's things that are constantly, we're in a flow, we're in a river. We're not in a static situation. So things are going to constantly change. And people will often say to me, Dr. Sager, you don't think, you're not spending a lot of time on my childhood, how my parents weren't that nice to me. And, I lived in a bad situation and stuff. I go, that's important, but what are we going to do about it now? Let's focus on the present. Let's put our feet right now. Um, you know, and we're not going to be able to change the past, but what can we do to get from here to the next step in your life. What is your intention? Where are you going? So I don't spend a lot of time on the past, and I think it's derivative from my idea of Buddhism that it's very important to be in the present moment.
Yeah, and in that way, the Buddhist approach is quite different from traditional Western psychodynamic
Mhm.
approach, where a ton of attention is paid in
Yeah,
what
yeah,
happened in the past.
yeah. It's not that it's unimportant. I mean, as you probably have heard of the Buddhist concept of, and actually Eastern concept of karma, because things that happen in the past, they will have a ripple effect into the future. But, at any given moment in time, we have a choice. We have some control over what we will do. And we can shift the energy, the karmic energy, so that it maybe goes from something that wasn't so pleasant into a new direction. And that's really what we want to try to do as a therapist, what I try to do as a Buddhist therapist.
Right. I feel like a lot of these concepts really blow me away. It's such a different way of practicing. It is interesting in psychotherapy practice, you can bring in so many personality, theoretical orientation, spirituality. Yeah, how interesting that is.
I could talk to you for hours. I know you as a gifted therapist, as a gifted human being, and I would love to hear, more about, how you practice and how you do things and stuff.
Thank you. Definitely, my practice has been changing and evolving. Like you said, life is a river. I think learning is like that, right? You're always incorporating new information. Well, I know our time is limited. I just want to make sure that I respect your time and we end on time.